You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. Dr. Colin Yoshida earned his doctorate in dental surgery from the University of the Pacific School of Dentistry, where he earned numerous awards for scholarship and excellence. He also holds board certifications in integrated biological dental medicine and naturopathic medicine and is certified by the state of California in oral conscious sedation. Dr. Yoshida loves what he does, and I can attest to that. Full disclosure, Dr. Yoshida is my dentist, and I'm very happy to report that I now love going to the dentist. How many people can say that? Dr. Yoshida combines the best in what one might call left brain knowledge, treatment protocols, and biological dentistry with what one might call right brain attributes like Eastern medicine, the practice of intuition, energy medicine, and ongoing education in natural and effective treatments. He's a smart, kind, and humble man with a big heart, and I'm so privileged to have him here with me today. Welcome, Dr. Yoshida.
Thank you, Palmer. I'm honored to be here, and I'm honored that you asked me to come on.
Absolutely.
So, yeah.
Absolutely. Well, this is a huge topic, and I'm so excited to dive into it with you. The importance of good oral health when it comes to healing from chronic illnesses like autoimmune disorders, and conversely, the causative effect of poor oral health or poor oral hygiene on overall health. And I see this all the time in my practice. I see so many people just changing their food, maybe managing stress, and they're wondering why they're not fully healing. So I'd like, in this case, to start with some definitions, if you don't mind. Could you describe what is natural or holistic biological dentistry, and what's the difference for people that don't know and just have a regular conventional dentist? What's the difference?
Okay, good question. In my view, it's a lot of different things, but it involves the materials that we use. I mean, I use stuff that other dentists use, but I pick them so that they're the most biocompatible. So that's one of the things, biocompatible materials. I can do pretty much everything now without metal. So I like to stay away from metal, anything in the body. But so that's one area. Materials, fillings, crowns, implants, dentures, anything really that can be made ceramic, I like better. And then stay away from metal. Of course, we want to stay from chemical as much as we can. There's no perfect material generally. So we pick biocompatible as best we can. So we want to stay away from other things. Medications such as antibiotics. I really don't like using it. There are a few occasions where I need to use it because of very serious infection. But generally, I want to stay away from very strong medication, prescriptions, things like that. If I can use homeopathics, I'd rather use homeopathic remedies rather than prescriptions for painkillers, instead of antibiotics, things like that. Some herbal and just simple stuff that you may have around the house. Baking soda, magnesium, Epsom salts, whatever. So sometimes these are better than what you buy as a prescription. Things like that. So as far as natural as you can get it. And I like to, for myself, I want to be as conservative as I can. So it's not really under the holistic thing, but I just use it. So if I can not shave a tooth away and fix it, that's another tenet of my philosophy, to be more conservative. So basically you keep the person's body in mind when you're putting stuff into it, right? And cutting into things like teeth can be very important, especially mouth rinses, toothpaste. This is very important. And how you clean, of course. So holistically, biologically, they're kind of interchangeable, these words that people use. So there's really no exact definition. But we want to just stay as natural as possible and stay away from chemicals and bad material for your body, but non-biocompatible. So that's kind of what I think.
Beautiful
Yeah,
description.
yeah,
Super, super helpful. And my
yeah.
understanding, and take me back, did you start out training as a conventional dentist? Did you have your own personal journey, or what caused you to become a holistic or
Yeah.
biological dentist
Okay, very
personally?
good. Yeah. So just like everybody else, I went dental school and got taught the normal everybody learns the same thing, right? So I graduated dental school and started practicing just like everybody else. I was a conventional dentist. I did stuff that now I would not be proud of. But everybody starts. And then my personal journey was I started my own practice and I was always health conscious type of person. And there was a conference put on by a group called the IAOMT. It's basically mercury conscious people. And there was a dentist online. So this is how it actually happened, right? So there was a dentist online. We were in a dental chat email place and people would ask questions and sort of thing. And every once in a while, this one dentist out of, I don't know, hundreds or whatever people that watch this that were online would say, hey, come on down to this conference and learn about amalgam. It can be very dangerous. And most people would not reply. There was nobody replying to this guy. And I would see this and I saw it a few times and I thought, okay, I'm going to check this out because I'm open to a lot of new things. So got myself to the conference and started hearing about mercury and dangers of that. And what really got it for me, what really internalized it was I went to a breakout session and what was happening was the staff and wives of dentists were talking. It was pretty interesting. I don't know how I ended up there, but they were talking about the symptoms of their doctors, their husbands, and the effect of mercury on them. And when I heard the symptoms, it was what I was going through. Memory loss, mood swings, brain fog, all these kind of things that I was a young guy. I was probably in my 40s, maybe 30s at the time. And I thought, gee, that's what I have. And I've got to protect myself. And so I got into doing this kind of thing basically to protect myself. It was kind of funny. I tell this story, but I was concerned about my own health first. And then I was like, yeah, I'm going to protect the patients. But I got in it to protect myself really from the mercury. So that's how I started the journey, was just learning about mercury, how to be safe about it. And then, of course, I learned more and more as I went along. Yeah.
Yeah. That's such a beautiful story. And
Yeah.
I like the expression enlightened self-interest,
Yeah.
where we start with ourselves. That's how we learn and grow, and
Yeah.
then we ripple out from there. So that's amazing. And so
Yeah.
how are your symptoms, and now that you opened this door to memory loss, brain fog, and mood swings,
Yeah.
did you find that when you went through the process, did you experience a healing of these things, or what happened?
It took, I still have some symptoms, but I did a lot of things to try to detox this out of me. And it's way better, but I still think I have effect from it.
Got it. Got it. Well,
Mm,
this leads right into my
mm,
next question, because there is an increasing body of research that's
mm.
establishing causal links between oral health and overall health. I think we've heard of the classic case of, is it gingivitis or periodontitis and
Yeah.
heart disease? And these, I see this between oral health and rheumatoid arthritis, maybe Sjogren's syndrome,
Mm,
diabetes, even pregnancy complications. And now I'm hearing
mhm.
about Alzheimer's and dementia,
Yeah.
this link to oral health. So, can you talk a bit about how oral health is the window to our overall health, and what your understanding is of these linkages?
Yeah, absolutely. So the oral cavity, so the mainstream medical generally thinks your mouth is disconnected from your body. and and they don't really see how this can affect heart disease, strokes, all kinds of stuff, right? Autoimmune. So, but the bacteria, it's becoming more known now that the bacteria in your mouth travel through your bloodstream, and there are very bad bacteria identified that cause stuff now. So the main problem is that even among dentists, it's not diagnosed well, and we're missing a lot of stuff. So this is one of my pet peeves is I look for infection where people wouldn't normally look for infection. So that's a big one. And then, of course, gum disease, all the things you mentioned, pregnancy, pre-birth, preterm births, it's related to heart disease, stroke, Alzheimer's. All these things are related to chronic inflammation. So I think chronic inflammation is the thing. It can be anywhere in the body, but in your mouth is so common to have chronic inflammation. Yeah. So I think that's one of the keys. So if you can lower this in your mouth, then of course your whole body. But definitely there's a lot of evidence now linking this together.
Well, isn't the mouth part of our gut? I mean, it's the opening to our digestive system, right?
Oh yeah, for sure. Yeah.
Right. And we have a microbiome in our mouth, just like we have a microbiome in our gut people think about. But I don't know that many people think about that your mouth is part of the gut. And
yes,
we know that healing and ill health begin in the gut. So I'm so glad to hear that you believe that doctors are now believing, the mouth is not a separate, disconnected from your body somehow. But our mouth is so close to our brain, right? I mean, this is where we have neurological diseases and Alzheimer's and MS and other neurodegenerative conditions. It's a really short road between your mouth and your brain.
Yes, for sure. Yeah. So the one thing with brain is, so the amalgam is the one thing that is really dangerous for brain. So mercury vapor. So and the more you have of these fillings, the more exposure to mercury you get. How do you get this exposure? Anytime you chew on the fillings, anytime you brush on the fillings, anytime you put heat near the fillings, it releases mercury. I mean, it's constant. You cannot stop this, no matter how old they are. So the Dental Association, of course, tells us once you put them in there, they're really safe. I do not agree with this, and I advise people. So that's the number one. Brain connection with mercury. This is extremely important. Of course, but infections can be in the bones, near the sinuses, and they go really close to brain. So, I agree. Totally agree.
We'll dig into that because I want to get into all aspects of this, different types of infections and where they might be. A couple of things.
Yeah.
You mentioned infections in the mouth, and one thing that your practice does that I absolutely love, and I think it's essential, is a cone beam X-ray, or what's known as a 3D X-ray. Can you talk a little bit about that? And I know not every dental office has one, maybe not every biological dentist office has one, but this has been a game changer for me personally as a patient getting, a cone beam X-ray. So can you talk about that?
So cone beam's been around for a while. Not sure when it came on, but it never really gained popularity till 10 years ago. And only surgeons and to put implants in, that was the big push to get these things. But the real advantage of having this thing is it'll create a 3-dimensional view of your jaw and any structure up here. That's what we look at anyway. And it's, I don't know how much better, but it's way better at finding infection around teeth, in the jawbone. And that's where I look. Compared to 2-dimensional x-rays, which get missed, like infections get missed all the time. Like I can compare them side by side and I would definitely miss it. So I almost require every person coming to see me that I take this because I do not want to miss an infection that could be potentially life or health threatening. Yeah.
So I thought I would take this opportunity to share a quick story myself of my experience with cavitations.
Yeah.
So in 2017, before I met you, I had a cold every month. Now, this is after I beat the MS, which was back in 2010. So I was free of autoimmunity, and yet I was catching cold after cold after cold. And I saw a naturopath who said, Palmer, did you have your wisdom teeth removed? And I looked at her like she had two heads. What in the world? Do my wisdom teeth have anything to do with the fact that I'm getting these colds? And she said, well, just trust me. I want to recommend that you go get a cone beam x-ray. So I went up and had a cone beam x-ray done. Sure enough, in all four areas where my wisdom teeth were removed, I had what are called cavitations, which I would love you to describe.
Yeah.
These are holes in the jawbone that didn't heal altogether well. And these areas in our mouth, which don't get oxygen, so it's anaerobic, is what a lot of infections love. They thrive in these cavities, these areas in our mouth, right? I had cavitation surgery in all four of those wisdom teeth areas, stopped having colds. In fact, I think I've had one cold since, but it was because my immune system had become so burdened trying to fight off these infections in my mouth that were stealthy. And the thing is, I didn't have any pain in my mouth. I had no way there was no link between what was going on in my mouth and these colds that I was having. But the result was just a game changer for me. No more colds. So talk to me about that and my experience, like what was going on there and why was that important?
Yeah, so cavitations, again, what it is a area in the bone. Most likely it's associated to where the wisdom teeth were. I do find them occasionally where other teeth were extracted, and the cause of these generally is from the extraction, but there is something else now that I do see these cavitation things next to where people never had wisdom teeth. And also I see them when they still have their wisdom teeth. So it's not always associated with an extraction. So I don't know exactly why it happens, like all the reasons. I know one could be the extraction, but it's not always. So it's really important to check for this, especially if you have already health symptoms of any kind. So
of any kind, anywhere in the body, right?
Correct.
Anywhere. Yeah. Okay.
Yeah.
Anywhere. So what percentage of people would you say have cavitations? Can you make a statement like that generalized?
I'd say 80 to 85% of people are coming in have at least one. So that's quite a bit.
It's huge.
Yeah. And most of them have four like you had. And I've heard this, once I treat them, I've heard the gamut of, I've had people with sciatica that goes away. I have people with gut issues that kind of go away, brain fog, energy. It kind of runs the gamut. Like I can never tell people these are the symptoms because it could be anything. And I can never promise that I can get rid of it. So that's something I always tell people. But it is a burden. Like you said, that's kind of my thing where I'd say it's just your body has to fight this constantly year after year after year. And there may be a point in time when your immune system reaches a tipping point and now you start getting issues. So I rather you treat this when you're healthy and you get rid of it and you can heal well. Yeah.
So what do you do? What's the process like? Just briefly, how do you correct this?
So my way is I do a surgical procedure. So surgically open the area near the wisdom teeth, usually open that gum. I have to enter into the bone where this hollow area is and scrape out soft stuff. So generally it's soft bone and sometimes usually yellow stuff is coming out of it. That generally, and then irrigate it out. So basically I just clean it. I want to get that spot to heal as best I can. So I use platelet-rich fibrin, which is platelets from you, the patient. And I take it from the blood. So I draw blood and I use that to pack into the surgery site. We use ozone gas, kill bacteria as best we can, and then sew that up, suture it. And that's basically the procedure you use. Yeah. And generally they heal. So success is generally very good. People ask me that question, like, when would it come back? Like, how often would it come back? My opinion is that it's not really healing and coming back. It never heals because of your diminished immune system. But I don't think it heals and comes back. So generally, if your body's immune system is strong enough to heal, it will heal. So I like people working on general health sometimes. If they seem weak to me, I want them working on general health first to boost them up, and maybe cleaning up any other stuff in the mouth I can do before we do surgical stuff.
Beautiful. That was another
Mhm.
question that I had, was the order of things, because many people have silver fillings and they come to me and say, and they realize that it's dangerous, and they say, should I just go have my dentist, my regular dentist, take out my silver fillings? And when do I get a cavitation surgery if that's part of it? And I always say, go see somebody like you and get a plan, like have the order of things done at a high level. Let's also throw root canals in there, because this is a really important consideration. And I would love your thoughts in general. If somebody has a root canal, do you automatically just assume it's infected, or do you need to do a cone beam x-ray to verify that? I've heard different people, different biological dentists have different perspectives on this.
Yes. So I believe everybody has their own way of doing it. My perspective on root canal. So first, I want the cone beam to rule out obvious infection that I can see. That's number one. Then, if I don't see infection on the cone beam, then I energetically test. So that's my own thing. I do dowsing is my technique, and I test it that way. So I double check it. And then if I feel like your body handles this okay, I might leave it in there and handle everything else. Because losing a tooth, it is an emotional thing. I mean, people don't want to lose a tooth generally, right? So unless it's in pain, but most people don't want to lose a tooth. So if I can predict that your body can handle this fairly well, you're in really healthy condition, I might leave a root canal in your mouth, which kind of goes against, I know that goes against the purest biological principle, but that's my own. I rely on my intuitive means of testing it, and I might do that at times. Yeah.
I love the fact that you do both the school educated, best of biological dentistry and that intuition or the energy medicine. I think it's a fantastic combination. So I think it's something that really sets you apart. Now, in the scheme of things, if somebody does have fillings and they are concerned about cavitations, do you typically do one first and then the other in terms of extracting fillings? Or do you do the cavitation surgery first if somebody has a mouthful of potential issues?
So generally, the first high priority is gum. If there's any gum issue, we want to clean that up. And then generally, mercury, we want to take care of that. But I test all of that stuff too, right? So sometimes they have a pain in a root canal. Maybe I get that out first, because we don't want infection and pain in the person. Like, pain is not a good thing. So it just depends on what's going on with the patient. So I test all of that. I even test which side is better. Is it right side better or left side better to start? Because usually when we're working on, especially amalgam, you want to just work on one side at a time. So we decide which side is first, cleaning, and generally, or if I'm doing a root canal and that hurts, if there's a cavitation like right next to it, I'll do that. But generally, I want everything else cleaned out and then surgical.
That makes sense. That makes a lot of sense. We have a tendency in the people that we work with who are healing from autoimmune disorders do not recommend mercury filling removal until their gut is more healed. As you were saying, you want the patient's general health in pretty good shape. So if they're dealing with a lot of parasites or yeast overgrowth, maybe mycotoxins from mold, you want your body to be able to detox well, because the last thing that you want to do is have mercury recirculating in your body and potentially going to your brain. So is that something that you recommend also, or in terms of just making sure that the patient is stable from a gut perspective?
Yeah. So if patient is in generally pretty good health, I want the mercury out as quick as I can, and then go work on the detox. That's my own feeling on it, because I just felt that if you start detoxing before the amalgams are out, you kind of spin your wheels a little bit because you're still getting exposed. So unless they really are weak and okay, you better go deal with that first.
Yeah.
But generally, I want the amalgams out as soon as they can. Yeah.
And that brings me to the second
Yeah.
part of the question, which is, let's say they have a regular dentist.
Mhm.
Would you recommend that they have their mercury removed by their regular dentist, or can you speak about the importance of having what is the acronym SMART? Something about safe
Smart
mercury,
protocol. Yeah. Yeah.
the SMART protocol. Can you talk
Yeah.
about that?
So yeah, so there is definitely a safe way to do this for the patient and doctor and team. So the SMART, if you're not familiar with what that is the, I don't even know what that stands for.
I'll
What
put
that
it in the show
acronym.
notes. Neither one of us remember, but it's something, it starts with safe mercury,
But
something
safe
removal
mercury, yes.
technique. Hmm.
But there's a whole protocol of things to protect the patient. So some things include we want to use rubber dams. So if you're not sure what that is, it's this piece of we use non-latex rubber. We isolate whichever teeth we're working on so that powder, whatever we work, doesn't really go into your mouth. We isolate that. We want a suction that will filter out mercury. So we have a external filter that comes like right in front of people's mouth. So whatever is coming out of their mouth will suck into this thing and filter. We'll also cover, so we want to cover everything. So the patient is covered with barriers, including their head when we're working. So we cover up their eyes and head and their body so that with disposable barriers that we take off later. And of course, I'm wearing a high filtration respirator that kind of looks like this thing with canisters on it. And we wear that for the procedure. And of course, there's air. So the patient is given air on their nose, pure oxygen, so that they don't breathe mercury vapor. That's pretty much the thing. There's different things like how to cut out amalgam, like how to get it out of a tooth. You want to have your dentist cut it in big chunks. So you don't want to be shaving off filling that can go everywhere. So you want to try to make as bigger chunks as possible and remove them so that they don't become little particles. And that's another and a lot of water. So we're shooting a lot of water to contain this stuff. But then you got to be careful with this splashing stuff too. So there's a technique to this. And then, and of course, once you get the metal out, we stop everything. We remove everything, rinsing. We have the patient rinse with charcoal rinse to try to gather up some of that stuff that may have gone in there. Remove, we throw out everything, we change all the barriers, and then we go again and finish the filling. So that's kind of the SMART protocol, which a lot of it's not that hard, but people have to know how to do it. Yeah.
So I will put in the show notes information on how to find a biological dentist, because there are a couple of organizations that I'm familiar with, and maybe I'll mention them now. And you said it at the top, which is IAOMT. I'm not even sure what exactly that stands for. I'll write that down. And there's another one too. I want to make sure that I know what that is. Do you know off the top of your head what the other organization is?
IABDM, International Academy of Biological Dental Medicine, I believe.
Okay.
IABDM.org. And then there's Holistic Dental Association.
Holistic Dental Association. That's fantastic. And some of these are international organizations. So it's not just finding some place in the United States, but this is definitely a growing holistic practice. So I'm delighted to know that more and more dentists are going this route. So that is fantastic.
I know for sure the IAOMT, they're the biggest organization. So people wanting to find different states, or that would be the biggest directory of doctors. And you can just go by state.
Let's go back to gum disease because you mentioned this, and this is maybe something that it's so prevalent. Does it start
Yeah,
as gingivitis and move on to periodontal disease? Is that a spectrum of
it's a
inflammation?
spectrum. Yeah, for sure. Yeah. So it starts off as gingivitis. Gingivitis means that the surface gum next to the tooth is inflamed. So it could be bleeding, it could be just redness, but that's gingivitis, the earliest stage of breakdown, inflammation in the gum. Periodontitis means that the bone structure below the gum is starting to erode now. So there's a mild, medium, and severe periodontitis. It just is saying how much bone destruction is happening. So once your bone destruction and support for teeth have eroded, that's when teeth get looser, and that's how people lose teeth a lot. And also having that loose tooth with bleedy gums, that's probably the biggest risk factor. It's heart disease. And so that's going to the heart for sure. Mm-hmm.
That is so interesting and probably very common, much more common than I know, is all these itis. Itis is inflammation, right?
Right.
That's an
Right.
inflamed something.
Yeah.
And so the clues that people would look for are your gums pink, or they should be
Redness
pink? Are
or
they
bleed
red
when
or
yeah.
bleeding, right?
Yeah.
Or painful or swollen
Could
with
be,
those?
yeah. Or when you floss, you notice it, or could be just, I floss once in a while and it bleeds, so nobody pays attention to it. But that's a sign that there's something going on here. Yeah.
Yeah, something to pay attention to.
Yeah.
So now I want to get into what can people do to reverse this process before needing, something more extensive treatment. Thank you.
Yeah. Yeah.
What can we do
So
at
the
home?
number one, yeah. So number one is the better you can clean the teeth every day, you can generally control this mostly by yourself. So brushing, flossing. I like water pick is kind of my favorite. So brushing, water pick, and you can brush your tongue. That's a good idea. And then there's a thing where people oil pulling. That's another thing. So oil pulling, I think it's a really good habit. Generally, I just take organic coconut oil and try to swish for 10 minutes or so. That's a really good habit. But generally, the better you can brush. So there's a specific technique I like to, there's electric and manual. Manual will work. Both of those will work. The only thing is with a manual brush, you've got to replicate that motion to clean in between well. And you can do this. And I don't know, maybe I could show it, but
now, are you doing small circles? Is that the idea?
So the
Upwards
main
towards
thing
the
is you can do
gums?
circles, you can do up and down, but I want that bristle massaging into the gum a little bit. So I want you pushing that into the gum a little bit. So there's a pressing. I learned this. It used to be called the blotting technique. That's how I learned this, where you kind of just blot. You're kind of pushing the bristles into the gum. That disturbs that plaque, that biofilm. And that's enough. You just have to disturb things, and then the bacteria kind of knock off for a little while. And then I like water pick to shoot in there. Something I've changed just recently in the water pick for people that use this, I like a little bit of baking soda now. So I want a little bit of powder that makes some abrasiveness so that it cleans off that biofilm better. So that's a little change I've made, since you probably didn't hear me say this before. But but that's kind of my regimen. And if people can do this well, because I have people who really fanatical about it, and it's healthy, right? So I think that's the number one. If you can take care of it, that's the best.
Okay, question for clarification on that.
Yeah.
Are you speaking about dipping your toothbrush in the baking soda? Or are you talking about putting baking soda in your water pick? Because I want to...
Yes. So both. I like a little bit in the water pick, and then I like once a day baking soda on your toothbrush, and just dip it, wet your brush, dip into powder, and brush. So I like that at night, brushing with baking soda. And then in the morning, I use something else. I use a clay-based product, but just stay away from fluoride. I don't know how many people know about this, but fluoride is a neurotoxic thing. So we want to just avoid fluoride. But I like powders better. Yeah.
I love it. You can make your own at home. There are powders that you can buy that include clay, and then you can put these fantastic spices in there, like clove and cinnamon. And what else
Yeah.
would you put in? Baking soda. And
Yeah.
you can find all kinds of online recipes for
Yeah.
a
Yeah.
good.
It can be really economical rather than these expensive tubes of things that I don't know. Sometimes they put more stuff than you really need in there. Yeah.
Yeah, I'm
Yeah.
so glad you brought up fluoride. That was going to be another question. So just
Yeah.
make sure that your toothpaste doesn't contain fluoride. I was actually going
Yeah.
to ask you about SLS, which is
Yeah.
another harmful chemical that they use to in car washes, right? To get things to foam
To
better.
foam. Yeah.
You don't need that in your mouth, do you?
Yeah. People like it, they're used to it, but it's one of the main causes of cold sores will break out from that thing. So you don't need to have that. You just got to get used to not have this foamy thing in your mouth, which, it's not that bad.
It's not that bad at all. And in terms of supporting the health of the oral microbiome, is there anything that we should be doing in terms of some sort of mouth rinse, or
Mm,
is there
mm.
anything at all that we should do to support
Um,
the health of our microbiome
I
in our
I
mouth?
generally don't like everyday rinsing. Salt water or something would be fine, but just heavy, very strong, even herbal rinses can be harmful. I want that microbiome to be pretty much your own. Like, I don't want it altered too much. So for sure, you want to stay away from Listerine and things like that. Any alcohol thing is for sure. So generally, I don't really recommend rinsing as a everyday thing. People ask me about peroxide a lot. So should I use peroxide? I don't like it on an everyday thing, even diluted for the same reason. It's just too strong to me, where it'll alter the bacteria in your mouth. If you do have a episode of swollen gums, maybe yes, use this for a week, put in your water pick, but not every day. I want it a week and stop, and then go see a dentist because there's some problem there
Yeah.
if you do have swelling. Rinses. What were we talking about? What was the question?
The oral
Oral
microbiome. Is there
microbiome. Yeah, yeah, yeah.
anything we should do to
Anything we should do.
enhance
Yeah.
it, or
Enhance it. I think the best way to enhance it is your diet, right? So I like fermented stuff, and that's the best way. So I spend quite a bit of time with your diet is probably the first or second most important thing you can do for your mouth, for cavities, for gum disease. If you're eating junk, I mean, it's not gonna be as good.
yeah.
So your diet is probably the number one thing. Yeah.
What's You brought this up. So what other lifestyle things could we do to optimize oral health besides taking good care of our mouth on
Yeah.
a daily basis? We're
Yeah.
using the right kind of toothpaste. We're not
Yeah.
overbrushing, and we're
Yeah.
eating a good diet. What else
Yeah.
can we do?
Of course, you have to see your dentist. Check this out regularly. Generally, I want to see people twice a year. Depends on the person. Like some people can go like once a year. It just depends. Generally, I want at least twice a year to see people. Check this out. I'm not
That's
sure
good.
anything
That's
else
good.
might come to me. Yeah.
Yeah, I don't know how much stress plays a role in this, but I do know that
Oh yeah, yeah, for
when we're
sure, for
stressed
sure.
out, our immune system is
Mm,
just it gets distracted.
yeah.
It's harmed. We have a lot of cortisol going, norepinephrine,
Okay.
epinephrine, right?
Exactly. Okay, so I do have a few more. So diet, sleep. If you're not getting good sleep, deeper sleep, enough of it, that weakens your immune system, right? So anything that weakens the immune system really will show up in your mouth. And that's one of the quickest ways to see it because your mouth will get inflamed. So anything that causes weakening of the immune system, so not enough sleep, high stress, antibiotics, medications, like a lot of medications, smoking, and of course, oral hygiene and breathing. So along with sleeping comes breathing. So a lot of people now have sleep apnea and they have this CPAP thing on their head. That's a problem. Or people are not diagnosed yet and they're not breathing well. So that's another problem.
Um, I don't have sleep apnea, but I know that I snore if I don't use mouth tape. So I have found for me personally, I've been taping my mouth shut for about 7 years. And it's
Yeah.
one of the best things that I've ever done for my health because
Yeah.
I don't get sore throats anymore. I'm not
Mm.
breathing through my mouth. I'm breathing through my nose.
Yeah.
So
Yeah.
talk about mouth tape, if you will, or your
Yeah.
perspective on this.
I like it. I do it myself. Yeah. For anybody that wakes up with their lips dry and their mouth dry, you're probably breathing through your mouth at night. So I just get 3M bandaging tape. It's you get a Amazon, you can get 6 rolls for I don't know, $5 or something. You just take a little piece, tape it on right at the bedtime. And if you have to breathe, like if people are worried that I can't breathe, what if I can't breathe? You will breathe. I mean, if you have to breathe, your corner of your mouth will open and you can breathe. So I like it a lot. That I would recommend. Yeah, for sure.
Yeah. I do the same thing. It's the 3M surgical tape.
Yeah.
It's super easy, super cheap. I
Yeah.
don't go a night without using that. What's the
Yeah.
importance of breathing through our nose versus our mouth?
Yeah. So the nose, so there's a few basic ones, like the nose will warm the air, will filter the air before it gets into the lung. That's the main one. I'm not sure what for the nose. There is, I know I've read those books like where breathing through your nose is super important.
Right. The
So
James Nestor book,
James
Breathe.
Nestor, breathe.
Right. I
Yeah,
think, and you can tell
yeah,
me this because
yeah,
you are a dentist, you know the difference between nitric oxide and nitrous oxide, right?
yeah, yeah.
So which is the laughing gas one?
The laughing gas is nitrous oxide.
Nitrous. Okay.
Yeah,
So my
yeah,
understanding is the difference is when you breathe through your nose, we
yeah,
produce nitric oxide,
yeah, yeah,
which is super, super important and calming to the system.
yeah.
When you breathe through your mouth, you don't get the benefit of
Correct,
producing
correct.
nitric
Yeah,
oxide.
for
Is that
sure.
that's another one, right?
Yeah. Nitric oxide, super important for heart, blood pressure, things like that, right? So, yeah, definitely important.
Yeah. So anybody that's got elevated blood pressure, heart conditions of any kind, any chronic illness, I would think would be a perfect candidate to tape their mouth shut. That's kind of the poor man's sleep apnea device, if you will. I mean,
Yeah,
I've never gone to get a sleep study. I've never been told that I am at a
yeah,
risk for sleep apnea, but I think there are a
yeah,
lot of people that are undiagnosed.
yeah.
And we do know that that is a huge risk factor for cancers, autoimmune illnesses,
Oh, yeah, yeah.
Alzheimer's disease, right?
Breathing while sleeping is super important, right? So people that snore is a symptom of restricted breathing, right? So even if you're not apnea, which is apnea means you stop breathing totally, but you can have restricted breathing, which is where just the amount of oxygen is reduced when you sleep. And this is kind of what I have been dealing with myself. So I'm not apnea. I did take the test. There's a home test you can do, and restricted breathing can be a problem as well. I've heard a statistic where even 1% less oxygen from optimal can cause brain issues and things like that. So me, of course, I want optimal. So how do you correct this, right? So ideally you do this in little kids, but if the space in your mouth is not big enough for your tongue and structures, then that can be a cause. So there's a lot of reasons. One is structurally, if your mouth didn't grow enough wide and there's not enough space for your tongue can actually fall back into your throat and block your air when you're sleeping. So one strategy is you, through orthodontics or surgery, you open this jaw out wider and actually forward. And that's one strategy. Also, if you widen this palate upper, your nose, actually, this bone is connected to your palate, will open up that too. So that increases breathing. But it's very hard in adults. So ideally, they identify this in little kids and you can intervene early and it helps them out
Yeah.
early. But in adults, you can have treatment, but it's surgery usually or orthodontic that is not comfortable for an adult. It's harder.
Yeah.
Yeah.
Yeah. There's a device that I'm
Yeah.
familiar with, and I actually tried it one time because I'm one of those people that has narrow face, narrow jaw.
Yeah. Yeah.
We don't have that naturally wide jaw of
Yeah.
our ancestors.
Yeah.
You know, the Western model where our
Yeah.
face is more narrow and long. There's a device called an ALF. I don't know what
Yeah.
it stands for, but airway something or
I'm not
other.
sure what it stands for yet.
Okay. ALF. I'll
ALF.
put it in the show notes.
ALF.
And
Yeah.
it's like a retainer, but it's put on the inside of your
Yeah.
teeth. So on the tongue side of your
Yeah.
teeth, and it's pushing things out. It's an expandy. So
Right.
rather than going in and breaking the jaw and having some surgery as an adult, there is a device that's a gentle way to
Yeah.
press the jaw out.
Yeah. So that's another one. Ideally for kids, works good. Adults not as good because it's just harder on
Yeah.
adults.
We're already
Um,
fully formed, right?
yeah, yeah. But if they're in, so nowadays they're recommending orthodontists, especially ones that know about airway, they're recommending you get an evaluation around 5 years old for these arch problems because they can try to intervene early. If they can intervene before 10, they'd rather do that. So that's more ideal and get things moving quick, even in baby teeth. And then adult teeth come in and there's lots of room for everything. So that's what they would rather be doing now. And that's another area. Orthodontics, the mainstream orthodontics, they don't believe this. So they want to pull out teeth and just squeeze things together. And it's not helping sleep apnea for sure. Yeah.
Well, we're so privileged to have people like you
Yeah.
who exist today,
Yeah.
who have a better appreciation for and understanding of, and just frankly, a bigger toolkit to be able to address these oral health concerns. Because the link between our oral health and our overall health is well established, and I think becoming even greater. There's a
Mm.
greater establishment of these links, and it's bidirectional, right? I mean,
Mhm.
poor oral health might lead to problems, but when you correct the oral health issue, we have seen dramatic improvements in patient outcomes.
Mhm.
I have one person in particular I'm thinking of, a woman who had type 1 diabetes, which she still deals with, heart disease, kidney disease, and she had a bunch of infected teeth and a whole host of things going on in her mouth. Went to the dentist, had everything treated properly at a biological
Mm.
dentist, and she reversed her high blood pressure. She went to her cardiologist who said, I don't know what you're doing, but keep doing it. I don't need you to be on this medication anymore. I mean, this was an astounding night and day kind of reversal of some of these chronic conditions based on her getting her teeth optimized, her oral health taken care of. So it's
Yeah.
not too late, and it's part of the picture. It's not the whole thing, because
Mm.
she also was dealing with other chronic infections in the gut and
Yeah.
so forth, but it's part of the overall picture.
That's a wonderful story. Yeah. Great.
It's so hopeful. So I want
Uh,
people to know, I want to leave on a very hopeful note that this
mhm.
is a big missing piece that I see every day in my practice, that people are changing their food, maybe reducing some toxins,
Mhm.
trying to meditate or exercise more, and they're
Yeah.
wondering why they are not healing. So if this sounds like you, I just really, really encourage you to find a biological dentist. And again, I'm going to put the acronyms in the show notes because they are very difficult to remember. But one is IAOMT,
See?
and one is holistic dentistry. And you can just
Dental.com. Yeah.
dental.com. You
Yeah.
can do a search wherever you are in the world
Mm.
and try to
Mhm.
find somebody like Dr. Yoshida. And Dr. Yoshida is here in California in Fremont at
Mm.
Fremont Natural Dentistry. And
Mhm.
I just could not recommend you and your team, your wonderful staff, enough. It's
Mhm.
been a life changer for me
Mhm.
and for my clients. And so I'm very,
Mhm.
very grateful for you.
Thank
And
you,
I wonder
Colin.
if you have any final things you'd like to add, if there's anything that I didn't
Um,
ask that you'd like to.
hmm. Um, I guess I'd just like to add that don't be too intimidated because a lot of people are intimidated by maybe the amount of work. Even cavitation seems like a big thing. Take things slow if you need to. I recommend people all the time, take one thing at a time if you have to do it that way, but get your way on the path to cleaning up things. You don't have to do it all at once. You can, but it doesn't have to be. So take things at your own pace, and that's fine. Because a lot of people get intimidated and they don't do anything. So that's an important thing.
I love that you said that for a couple
Yeah.
of reasons.
Yeah.
I think it can be overwhelming psychologically, but also financially for people to think about, oh my goodness, we
Yes.
just put a kid through college or whatever it is, and now you want me to do what?
Yeah.
Do what you can when you can.
Yeah. Yeah.
And to be able to work with a holistic
Yeah.
dentist like you to have a plan, get
Yeah.
a cone beam x-ray. Like
Mhm.
that's step one, find
Yeah.
somebody that can do the cone beam x-ray. Step two is to see somebody who can interpret it properly, but
Mhm.
then put a plan in place. That
Yeah.
plan might be you need to do three things, but you could do, step one this year, maybe next year you do step two when you can. I
Yeah.
think
Yeah.
that is
Yeah. Yeah.
I'm so glad you said that. I
Yeah.
missed that one.
Yeah.
That is huge. And I also want to add the cavitation surgery that I had
Yeah.
was so easy. It was easy
Mm.
breezy. I just want to say they did half the face and then the other half the next
Yeah.
time. And any surgery is you get a little nervous about, but this
Yeah.
was,
Right.
I
Right.
just want to really assure people that it was not a huge surgery and it did not take a long recovery process.
Mhm. Yeah. Generally, that surgery, people recovered pretty quick, usually. Compared to an extraction, I think extractions are harder to recover from. So, I don't know, people don't want extraction either, but it's a little easier. Somebody told me recently, like this week, I think, when I said that comment, I was like, it's easier than an extraction. And they still were like, oh, they were all nervous about it.
Right.
So extractions aren't easy. Yeah.
But on the other side of
Yeah.
some of these surgeries or extractions
Yeah.
is the hope for a relief from symptoms.
Yeah.
We're not saying 100% certain that whatever is going on with you, that you will heal 100% if you just have, this type of dentistry done. We are
Yeah.
saying that this is a way to unburden your immune system, and
Yes.
that's a path. It's a step on the path
Yeah.
of healing.
Yeah. I want to make one more comment about root canals, which, like I made the comment, well, sometimes I'll leave it in there, not touch it. But any root canal is a liability. It's a liability to the immune system. So if people are worried about, some people get worried about stuff like that, it's safer to remove them.
So everything that we do when we work
Yeah.
with somebody like you
Yeah.
is a step towards preventing health
Yeah.
issues. It's a step towards healing existing health issues. And in
Mm-hmm.
my view, it's always a good step,
Mm-hmm.
whatever you're willing to do.
Yeah. Perfect. Exactly.
Well, I'm so grateful to know you, that you're my dentist, that you were willing to come on and talk with me and
Yeah.
our listeners today. I'm just so grateful, Dr. Yoshida.
You're welcome. I'm glad to know you, and what you do is important as well. So, thank you for what you do as well. Yeah.
Thank you so much. I look forward to seeing you, as I always look forward to going to the dentist. I look forward to seeing you again
I
soon.
look forward to seeing you. Yes.
Yes, you take great care.
Thank you, Palmer.
Bye for now.
Okay, bye-bye.
And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.